Hi, it's Dr. Arif Rajpura here, Director of Public Health at Blackpool Council, here to give you an update on the coronavirus pandemic and how it's affecting Blackpool. So last week I said to you that the rates were coming down. That has continued. We are still seeing that downward trend, albeit slowly. So we're now at 250, just over 250 cases per 100,000. And that compares favourably with the Northwest average, which is 390, and the England average, which is 370. So we're quite a bit below the Northwest and England average, and quite a bit below some of the other areas in Lancashire. So I'm really pleased about the trend. It's going in the right direction. Of course, I'd like to drive those rates even further down. So yes, we need to all continue playing our part in trying to get those rates down as low as possible. So pleasing trend, but we still need to do more to get those rates further down. And I think that those lower community rates are now also translating and have been helpful in reducing hospital admissions. So the hospital is starting to see, although it's really busy, the hospital still, it is, but it's starting to see a decline in the hospital admissions as well. So that's another pleasing trend. And of course, Jim Gardner, the medical director at the Trust, does a blog, so you'll be able to get more detail about the hospital situation from Jim's video blog. So a pleasing situation, but more work still needs to be done. In terms of the other developments this week, on Monday I was down at the launch of the mass vaccination site at the Winter Gardens, and that was absolutely tremendous. Really, it gives us that hope and light at the end of the tunnel with things like the mass vaccination sites being implemented and up and running. So I was thrilled to be down there, and I saw the layout and how it's going to function. This has happened through the hard work of so many people. So many people have come together. Obviously the NHS, but the Winter Gardens is, a council, arm's length company that owns it. So, collaboration between the council, between the NHS, with all the volunteers that are required. So it's not just the immunisers inside, but it's all the people that are required to do the marshalling and making sure that everything is in place for the centre to function, all the administrative staff, and of course our army colleagues. And our army colleagues have been vital during this pandemic response. They've supported us with testing, they're now supporting us with the mass vaccination site. So if you're invited to attend for a vaccination at the Winter Gardens, please attend your appointment. Wait to be called, but attend your appointment. Please be assured that COVID secure measures are in place across the site to ensure everyone's safety whilst they come in for the vaccination. So brilliant development and really great news for Blackpool and for Lancashire with the setting up of that. Disappointingly, though, you'll have seen in the press, Lancashire's vaccine supplies may be reduced and diverted to London and the South East so that they can catch up with the rest of the country. I was extremely disappointed by this news. The north of England has, historically suffered disproportionately from inequalities, health inequalities. There are some areas, thankfully Blackpool's been done pretty well with COVID over the last few months. We've kept the rates down as low as we could. But other areas of Lancashire obviously faced high levels of COVID throughout the pandemic, since the summer, throughout these last few months, and so they faced severe ongoing. We've all faced severe ongoing restrictions for a number of months now. So the vaccine offers us that opportunity to get back to some degree of normality later in the year, and just because we've made an absolutely fantastic start, it feels like we're being penalised for that. So I've made representation back up, as has the Lancashire Resilience Forum and other colleagues across Lancashire, that we feel this is highly unfair, and this is, we've become a victim of our own success, and I'm really displeased about that, because it's just not good that we're being penalised for hitting the ground running. You know, we've done really well in terms of vaccinating people. And, you know, if we get more vaccines, then I'm really keen on, you know, supporting the NHS to run that facility 24/7 if we have to get through all the priority groups, because that's what we need to do to get back to some normality. Also, unfortunately, you know, there is a lot of misinformation about the COVID vaccine floating around. There's lots of these WhatsApp experts sending all sorts of nonsense on and sharing videos and things like that. You know, the amount of sort of WhatsApp scientists and doctors that I've seen really worries me. You know, please, if you see something on WhatsApp, look at where it's come from. Are they credible? Is it a credible source? You know, in my book, what everyone should do is to go to trusted sources. You know, go to the government website, go to the NHS website, go to our council website, and you'll find all the relevant information. 𝗨𝘃𝗍𝗃 Lancashire and South Cumbria have some great information on their website too. It's got a frequently asked questions section, so please go on that website, and we'll put a link to that at the end of this video. The other thing that happened this week was the BBC national news report on COVID and how it's affected Blackpool. And again, I was really disappointed how the BBC covered that report. It really talked Blackpool down. It misrepresented the death rate in Blackpool, and we've complained to the BBC about that report. So we'll continue to fight for Blackpool, and of course we all need to continue doing everything we've been doing. My sincere thanks to everyone in Blackpool who's worked really hard to keep the rates you know, as low as they are. And you know, as I said, you know, we are doing well when we compare ourselves to other areas. We've still got a couple of months to go, tricky months still to go. I think the effects of the vaccine and the groups that we've vaccinated will start to bear fruit sometime in February. You know, we'll start to see the protection particularly in the older stage groups that we've vaccinated and in the care homes. As we roll the vaccination programme out and we do all top 9 priority areas that 𝗍𝗍𝗍𝗃 have said, so that's pretty much everyone over the age of 50 and all those people with a clinical vulnerability, and of course frontline health and social care staff who look after those vulnerable people. If we do all of those groups, then we potentially prevent 99% of the deaths from COVID, which is, you know, such a fabulous thing to aim for. So, you know, I'll be supporting our NHS colleagues in trying to get all those vulnerable groups vaccinated. But in the meantime, we all still need to follow the guidance around hands, face and space. Wash your hands regularly. Make sure you're keeping at least 2 meters away from other people who are outside of your household, and wear a face covering where it's necessary. Of course, please, you know, if you've got symptoms, you know, you need to go and get tested. If you're unsure about your symptoms, if you're not sure whether you've got COVID or not, I'd rather you get tested. There's plenty of testing capacity at our test centres. The one at the end of Yeadon Way, you know, book online or ring 119 and you'll be able to get a test. So thank you very much for listening. This has been a longer message than usual, but I think there was a lot to cover. And my sincere thanks to everyone for listening to me and following the rules. Hopefully we can continue with the trend downwards, and I'll be speaking to you again, hopefully at the back end of next week again. So thanks for listening. Stay safe, take care of yourselves, and I'll see you on the next one.